Fund, which will also supplement government resources with regards to responding to epidemics and pandemics. Secondly, as PMRC, we would like to recommend that the National Disaster Relief Trust must be immediately operationalized to ensure that funds are readily available. We'd also like to recommend that there's need for the construction of highly infectious disease isolation hospitals in each province so as to meet the demand or in cases when we are facing epidemics and pandemics. Then thirdly, we'd like to recommend that there's need for the multi-sector contingency and response plan to be reviewed frequently, as well as sensitization to be done among stakeholders. And lastly, we'd like to recommend that the guidelines must be developed and adhered to with regards to receipt, allocation, and distribution of pandemic and epidemic-related donations. With this, Chair, I will end my submission, and thank you for your attention. Clarification with regards to the last recommendation that we made, and I think I'll just read it for the sake of other members of Parliament. I will read the recommendation. And as PMRC, one of our recommendations was that guidelines must be developed and adhered to in receipt, allocation, and distribution of pandemics and epidemics-related donation. So failure to have these guidelines does not necessarily mean that we as a country are not prepared. We're actually prepared, but this is one of the gaps that we've noticed that can also help to supplement or to effectively ensure that we as a country are prepared to address our response to epidemics and pandemics. We are aware that there have been a lot of donations that have come through, and I'll just give maybe the most recent in terms of COVID-19. And so what we need as well is to have proper guidelines that will also be uniform, that can be circulated to all key role players. And these guidelines must be adhered to so as to ensure the effectiveness and the approach, ensure that resources are actually allocated in the appropriate manner. And secondly, the Honorable Minister wanted us to find out if we've learned any lessons from previous epidemics and pandemics. I must say that we really have mentioned, and it is because of time, but some of the other findings that we had with regards to that to do with COVID-19, we also had other frameworks that were put in place as a result of the AIDS response fast-track strategy. We also had the Zambia Ebola Preparedness and Response Plan. But one of the things that I must note to say that lessons might be learned, and the most thing that actually hinders us responding adequately or maybe in good time is the result of lack of resources. And I had mentioned previously to say that it's also about our health, the kind of health environment that we're in. Predominantly as countries like Zambia, most of the time we also have infectious diseases which other countries no longer have. And we've also seen an introduction of non-communicable diseases. So most of the funds that we have with regards to the health sector, they might be going to other cases such as TB, malaria, which are also cardinal. And that also leaves less room for resources to be put in place with regards to epidemics and pandemics. So as PMRC, we also try to call to say, in as much as resources may be limiting, there's also need to also ensure that our national health bill is also in line with international protocols. As it is for the 2021 budget allocation towards the health sector is only 8.1%, which shows forth of the Abuja declaration of 15%. So if we were to meet some of these protocols or maybe some of these guidelines, it also help to ensure that there's enough money within the health sector which will also be taken to issues to do to respond with epidemics and pandemics. Lessons might be there, but the only way we can execute these lessons is if we do have adequate resources. And so as a country, we also need to look into ensuring that our health sector is adequately funded. I hope I've answered the questions for Honorable Kinto, and I'll just ask my colleague to come in for the third question that we had asked.
Thank you very much, Chair. On the first question, which is saying, how then do you maximize resources given to us through resource mobilization? Yes, we must mention and agree that at the time when the resources started coming in, that was a bit earlier before the ministry and other stakeholders could come up with a contingency plan. So if you look at the Auditor General's report, one of the weaknesses that they gave, which led to money not being properly used, was the late coming of the contingency plan which came only later in March when money started coming in earlier than that. Thank you. Evidence with research has said the vaccine is what will contain the spread of the epidemic. The vaccine can come in and be administered, as well as other measures that have been put in place, like social distancing, washing of hands, and the like. Thank you.
Folks, to remember those that are with us, folks, to realize that a lot of infections are happening and is expected of them to save our lives and as communities, and we only ask that us as really strongly have to rethink how we allow ourselves that. And then with the question following.
One of those who actually feels that the vaccines have been developed in a very short period of time, and it's also one of the opinions that most of our public would have. But as I had mentioned earlier, to say that non-state actors also play a key role in terms of research and development. As an institution, as PMRC, we might not be very specialized to do with issues to do with such research, but we also would like to call upon government to also consult from key non-state players, it might be World Health Organization, to just try and see if indeed the vaccine is okay or should be administered to people here in Zambia. And once we're given a go-ahead maybe from World Health Organization, and we also have some trial tests, and we also see the evidence that is there with regards to the safety of the vaccine, I feel it's I'm not against the issuance of the vaccine as long as all those consultations are done. And in my view, I should believe that in order for the government to actually should put a line to say that the vaccine should be administered to the Zambian people, then the needed consultations were done, as well as the evidence was provided. And if there's still need for more research to be done upon it, we can actually recommend the government to actually extend the time frame in which the vaccines might be administered to the Zambian people. Now, coming to your question, Chair, with regards to Zambia's preparedness, looking at the issue of the COVID pandemic, I must mention to say that with regards to the policy, the legal frameworks, they have been put in place, the strategies and measures that have been put in place. But one of the reasons, and to my conclusion, I'll just put it to say that we're not prepared for this. And one of the major reasons why we're not prepared is issues to do with finances. We can put in strategies, we can put in activities, and we can also put in measures that can help to curb epidemics and pandemics. But without the necessary resources, it's very difficult for us to actually look into us responding to epidemics and pandemics. And this is why we as PMRC in our budget analysis, we always mention the recommendation of having the health sector budget allocation meeting international protocols of achieving 15%, because right now we're currently at a deficit of 8.1%. So if we had that efficient allocation from government and also from donor organizations, we can also use that to tap into responding to the measures that we have put in place as a country with regards to preparedness and epidemics. But that again is going to be difficult because we also need to look by nature of our health transition. There are other countries that are just fighting non-communicable diseases, and hence they also have the resources that can also help them to effectively prepare for epidemics and pandemics. But for us in Zambia, we still have infectious diseases. We still have we have got the issues to do with non-communicable diseases, but also pandemics as well as epidemics. So moving forward, I think this is the major highlight of our recommendation, is to ensure that the adequate resources that are going to be put in place in order to meet the financial deficit that's already existing within the health sector. Thank you very much.
About vaccines and what can be done about this. I think it's about time as Zambians, or as Zambia as a country, that we begin to add more funding to our own localized research and development of our own vaccines. For example, we have the National Biosafety Authority. Can we empower those scientists there to be able to conduct research and also to find local solutions that fit our circumstances. I think if we empower our own local scientists, they can be able to find localized solutions to some of these problems and skepticism that we have in terms of vaccines.